briefing of journalists was to inform Nigerians on measures taken by the federal government to prevent importation of coronavirus outbreak in China, which is gradually spreading to other countries. The Minister of Health, Dr. Osagie Ehanire, says the disease, which is majorly transmitted from animal to human and from human to human, is deadly. He says the federal government has taken steps to prevent its importation by setting up a multi-sectoral committee comprising security agencies, aviation and transport sector to work with port health services.
There is high-level interministerial consultation towards setting up a multi-sectoral committee to scale up surveillance and vigilance to detect suspicious cases and ensure containment at all points. The committee shall comprise of critical stakeholders in the health, security, aviation, and transport sectors, and also include development partners.
Dr. Ehanire says Nigeria has the capacity to test, detect, and respond to any outbreak of coronavirus, as he advised airline operators to take note of any passenger that looks ill or sick while on air and report such persons to port health services.
The Ministry of Health hereby requests all parties to air travel industry and stakeholders to apply existing standard operating procedures, and airlines in particular are reminded of their obligation to comply with the protocols for reporting passengers who fall ill or look ill on board, so as to activate response plans on arrival of the affected aircraft. As the events unfold, we can see that the risk of importation is present for all countries. However, the ministry wishes to assure Nigerians of the capacity to detect, assess, and respond to these and other public health threats.
On Lassa fever, the minister says 258 cases have been confirmed with 41 deaths, saying that rapid response team has been deployed to the 5 most affected states to prevent further spread. He says 5 health workers have been affected, out of which 2 lost their lives.
Despite this increase in number of confirmed cases, the overall case fatality rate for 2020 has been just about 15% compared to the same in 2019, which was 20%, and a few years ago, the case fatality rate was over 30%. While we are gradually moving towards achieving less, that is to say, single-digit case fatality rate, we continue to support response activities like surveillance and contact tracing in affected states through the deployment of rapid response teams for improved case management and outcomes.
In all, Dr. Ehanire advocates for change in behavior in the way food are stored, maintaining clean environment that will be free from rodents, and frequent hand washing, as well as use of handkerchief when coughing or sneezing. Joseph Kadiri, ITV News, Abuja.